GERD, or gastroesophageal reflux disease, essentially acid refluxing from the stomach up into the esophagus. Typically have a normal anti-reflux barrier, so when this barrier, this valve, becomes dysfunctional, that's when a lot of people get these reflux events. They can cause a variety of symptoms: heartburn, nausea, vomiting, difficulty swallowing, regurgitation. When to seek attention would be when symptoms are persistent, chronically, usually more than 6 months or a year. If you tried these medicines, over-the-counter medicines, whether it's Pepcid, Prilosec, any of the over-the-counter medicines, and the symptoms are still persistent. A lot of things can happen with long-standing acid reflux. Probably the most worrisome condition is something called Barrett's esophagus, which is kind of a chronic change to the esophagus where the lining almost changes to protect itself from all the acid reflux damage. It is a precancerous condition. The TIF, T-I-F. It stands for transoral incision-less fundoplication. Our goal is to wrap the lower part of the esophagus with the upper part of the stomach, again creating this anti-reflux barrier. They traditionally did it laparoscopically through the abdomen. Now we're been able to do it through the mouth. The endoscope itself is passed through this device, this fundoplication device, and slowly actually grasps the stomach and esophagus and wraps it around the esophagus, creating this 270-degree wrap around the esophagus. And it really creates a very great barrier to acid reflux. It really reduces your hospital time, your recovery time. Most of the patients are home either later that day or the next day. A lot of these patients, the majority of these patients, are able to get off their acid reflux medications fairly immediately. Get a good 6 to 8 hours of sleep, I think, is really a big change for a lot of these patients. The biggest improvement is in quality of life.